I've been recently asked a very interesting question. I have placed my mom who have end-stage Alzheimer and is having dysphagia, means inability to swallow, and she can't really take food without choking, especially fluids. She will always almost choke when she's taking fluid. So the specialists here in Thailand have actually placed her on a nasogastric tube to enable food to be passed from a tube extension that comes out from her nose that connects to her stomach. The question I'm asked is that why not place a PEG tube instead? Because you see, when we put a nasogastric tube, there will be a lot of phlegm production that comes out because the throat, the passageway is irritated with the tube, right? So they will come out with a lot of phlegm. Already they can't swallow. So when you do a placement of PEG tube, you have to always do the phlegm suction, or else if not, right, there is a danger of choking and aspiration pneumonia. Now, I was actually being asked why not a PEG tube. The reason being is because when you place a PEG tube is actually good. It is a better option in a way that when it comes to tube feeding, right, because it doesn't need to go through the throat, it would not give a lot of mucus secretion, which come from the irritation of the tube. But a PEG tube is, in my opinion, suitable for a person who still have cognitive function intact. Means the person is able to think and is able to know what is happening. When you see a lot of times when you are putting in a nasogastric tube, it is a very obvious thing. It is like something is a tube hanging out of your nose. When you go out, everybody is going to look at you. Everybody is going to notice. So this person, if the cognitive function is still intact, they are going to be very self-conscious. Therefore, for cases for people who are not having dementia or Alzheimer, or they may have some temporary setback that not enable them to really swallow, or is a permanent neuromuscular degeneration, or if they are having diseases such as ALS, whereby they lose the ability to swallow, then the placement of the tube is usually done at the stomach. But for temporary cases, I'll backtrack again. For temporary cases, normally the doctors will advise a nasogastric tube. For an Alzheimer patient, we really should not use a PEG tube unless there's no other option. Reason being is that because when you place them on the tube feeding, for Alzheimer patient, they do not, you cannot tell them, oh, that is a tube, you have to be careful and you shouldn't rub it. When we place an Alzheimer patient on the tube feeding, the key to ensure that they do not pull out the tube is to use protective hand mittens. Like for example, for my mother, I don't restrain her. I have the mitten that is specially made. I have the DIY ones, which was sold by the hospital. I also have the professionally made ones. They are not expensive. They cost me about 450 baht a pair. 450 baht, I think it comes out to probably less than USD $15, less than USD $15. So these mittens cover her hands and does not enable her fingers to bend and pull out the tube. So if you want to place an Alzheimer person on tube feeding, it's very important to have the hand mittens, protective hand mittens, to prevent them from pulling out the tube. And normally when they already reach that stage, they won't be upset with the hand mittens or with the tube that's hanging out of their nose, but they will get irritated by it. So even with my mom with nasogastric tube feeding, she still take her hand and constantly rub on her nose, trying to get the tube out. And there was twice she was actually successful. Whereas for the if that is, they're sure they will do the rubbing. So I've also learned to secure the the tube, I use a microfiber tape which actually secure the tube to her nose, and it have to be done properly to make sure that when she rubs, right, the tube doesn't come out easily, because when you rub, as you do the rubbing motion, then the tube will slowly, if the tape is loosened, it will come off. So learning to put the tape is also a skill. Imagine if you put a PEG tube, because these structures it will cause irritation. Someone, when you put a PEG tube, right, they won't be able to turn that easily, and they will feel some sensation in the stomach. So feeling the sensation, what they're going to do, they're going to rub again. They're going to rub and rub and rub. And then when they rub, right, it's very dangerous, because this there's like a kind of incision, right, is surgically placed. So if they rub and rub and rub on it, right, you can imagine there's a danger in making it into a wound. And when we do the feeding, because when you open up, right, there's actually stomach acid, it's hydrochloric acid. So if there's a wound, right, it may risk in causing the skin to be corrosive. So that's why for Alzheimer patients, doctor would not advise to put PEG tube. Of course, I know in overseas they don't even encourage to put a feeding tube at all. But what I can say is that if you watch my previous videos, if I think that is very because most of the time for Alzheimer patients, they can still eat. What I mean is that the digestion and elimination works perfectly fine. Just the problem is they can't swallow. This problem is other illnesses like ALS also have it. They can't swallow. When they cannot swallow, right, and the other functions are working, I would think that it's very it's not right to deny them of food, because once you put the food in via a feeding tube, they're going to survive. Just like if a person cannot pass motion out effectively, if let's say they have colon cancer and and the part of the colon or the rectum is damaged, and they permanently cannot really pass motion out on their own, a colostomy bag is being attached permanently. So we can't say that because there's no cure anyway, then we don't attach the colostomy bag, because they won't survive without the bag, because the waste won't be eliminated. It's the same as for Alzheimer patient. If they can still eat, right, if you put in the food to them via a feeding tube, it's going to help. Just that we have to be careful we have to do phlegm suction. We have to make sure they don't slide down the bed to prevent aspiration pneumonia and the reflux of the food. We have to actually be careful with the tape that is securing to their nose, and we have to use a hand mitten. Means we have to buy a few pairs of hand mittens, and they have to be long-term on these protective hand mittens to prevent their fingers from moving and pulling out, because for sure they will reach for the tube whenever their fingers are free. So once we got that taken care of, right, they can survive on tube feeding without going in hunger. But a PEG tube is really not advisable because the PEG tube, they are going to rub. And to me, hand mittens is okay, because they are not distressed with hand mittens, but will be a bit inhumane if you're going to tie them to the bedpost. I don't tie my mother's hand to the bedpost or to the bed railing. Her hands are free to move and swing about, just that her fingers are being covered. So when her hands are free and to move and swing about, definitely she will rub against anything that make her feel uncomfortable. That includes she's constantly rubbing at the tape that is securing her nose, her nasogastric tube. And if there's a PEG, that I can bet for sure she will rub. Even if we restrain their hands to the bed railing, right, they will still be able to rub, because they are going to bend their body and they're going to adjust the position, and then the hands will be able to rub. So PEG tube And things like another thing is tracheostomy also is not being. I also don't really advise having a tracheostomy done. We skill. If the person have no underlying lung condition, with skill we can slowly learn to do phlegm suction for the person. So the phlegm suction, you can do the suction from the oral and get out the phlegm out. If you do tracheostomy also, they're going to use their mitten hand to rub against the structure, and it's very, very dangerous because a tracheostomy is an incision we do at the trachea. A trachea is not a soft muscle. It's very dangerous, it may rupture. So that's why, and also doing tracheostomy, when we do the phlegm suction, I notice a lot of the patients seems to be in pain. So for me, I don't do, I have declined tracheostomy for my mother. And even the doctors also don't really advise against that. It is an invasive procedure. And then once you do it, if they keep rubbing, right, and then the structure come off a bit, then it may be open to wounds and as well as infection. So currently, that's how we are managing with nasogastric, and that's why we don't consider a PEG tube placement for her. Hope this helped to clear your doubts. Thank you.